Today, we're talking about heart health and functional medicine. And as a functional medicine expert of 30 plus years, Dr. Bob, what have you seen over the last number of decades when it comes to heart health? Is it on the decline? Is there more instances of heart disease and heart issues on the increase?
Well, you know what, Eric, we might see an increase, and especially among younger people, because of some things that have been done recently, and if you're paying attention, you might see that a lot of young, healthy people have suddenly dropped dead, sudden cardiac death. But that's a different topic. But, this decline has been going on since about 1960. So I want to show this graph here with the American Medical Association. Now, that's the advantage of being on our Zoom for Instagram. Here's what I'll tell you. From 1900 to 1960, heart disease and death was on the rise, but it's been on a decline since 1960. And, that graph ended like around 2010, but then we go forward from 2010 and we see the decline is still through. The most recent data that they had published in the medical literature was 2022. But Eric, I want to compare these two graphs for a moment. So here is a graph of cigarette smoke consumption. And you'll see that it rose and rose and rose, about to the same time that cardiovascular death declined. And what I did through the magic of computer graphics, I just took this line, I copied and I pasted it, and I put it right over the cardiovascular increase and decline line and matched them to scale to the exact year. And you couldn't find two better fitting lines if you tried. So as people smoke more, they died more younger. We had a conversation yesterday. God bless your dad's amazing soul. He lives in your heart. He lives in the world's heart, and his legacy lives on, but he smoked. My dad smoked until he had a quadruple bypass, then he quit. But, my dad, at age 50, he became the oldest living male in the family tree. His dad died at 49 of a heart attack. His grandfather, 37 of a heart attack. Happy to say my dad's 81 now, takes 0 medications, and gets up 6 days a week at 6 a.m. and goes to the gym. But he quit that smoking and he started taking on better habits too. But cardiovascular death has been on the decline since about 1960. And certainly smoking is the biggest risk factor, but there are others. And I'm sure we'll get to those as well.
When it comes to genetics, you see a lot of people who do have heart issues in their family. I've had uncles who've died of heart attacks. My own dad actually, unfortunately, passed away 4 years ago because of a heart attack. But there were signs, there were indications, there were red flags to say you need to make some lifestyle changes. So apart from, let's say, the chest pains or maybe shortness of breath, what are some of the other kind of signs that people may see that could be saying, you need to really pay attention here and look at your overall health?
Well, I'm going to answer this a little differently. The cardiovascular signs could be chest pain. They could be shortness of breath. They could be lower levels of energy. But you could be getting a big belly, and if you got a big belly, you got a big problem. In fact, I once created a graph that just said that: big belly, big problem, because you could have a fatty liver. You could have fatty liver. You could have pre-diabetes. That could lead to high blood pressure. The same factor that sets up big belly can set up the blood pressure, the blood sugar, and the cholesterol issues. So it really comes down to choices. And what medicine uses as markers, well, these are downstream markers. These are not primary cause. You've got to eat right, drink right, think right, move right, sleep right, poop right, talk right every day. And the big four: stress, toxins, malnutrition, physical inactivity. And I like this. This was a 2022. In fact, what a great day to publicize it. February 22, 2022, they talked about the big seven. Number 1 was diet. Number 2 was weight. Number 3 was exercise. Number 4 was quit smoking. Those are all important. And then they said blood pressure, cholesterol, and blood sugar. But hey, if you get the first half of that graph right, or that picture right, you're going to be okay. If you're managing your stress, doing diet and exercise, you're going to be okay. Don't smoke either, right? Ever. No excuse for that one.
Yeah, that was the big trip up for my dad. He ended up getting a blockage in his neck, and he actually had that conversation. I believe your dad had it as well. Was that stop smoking, you're literally going to die. And of course, my dad, having selective hearing, literally said, "Oh yeah, sure, doctor, I'll cut down." And the doctor said, no, you need to stop. You need to stop. And he did for a while. He cut it out, and then it just kind of crept back. And, if you have family members in your life who know are not on a path towards health, what advice would you give to that person, Dr. Bob? Because I literally sat down and had a conversation with my dad, said, "Look, I love you. I'm never going to tell you what to do, but I believe you're at a crossroads now." And, I kind of went down the route of, slightly guilting and shock factor, I said, look, you're at a crossroads and you can either do what you're currently doing and risk not seeing your grandkids, or you can change your habits step by step, and I'll be here to support you. So that was my approach. It worked on a short term, but what advice would you give to people if they have family members who have these habits of smoking or dietary issues that are kind of pitfalls and that you think they're heading towards a slippery slope?
Well, let's talk the smoking one first. So, one of my great mentors, we're talking before my even first day in clinical practice. I take a good history. People fill out paperwork before they come in. And this is what this mentor told me. He says, if someone smokes, your first words to them are, you need to quit smoking. So here's the story. I had a gentleman come in. He had just retired. He was looking forward to a life on the golf course, or retirement life on the golf course. And, he had neck pain and shoulder pain. So he walks in and I go through his history and I see he's a smoker. So he's in the waiting area and I look out to him. I reach out and I shake his hand. I say, hi, I'm Dr. Bob. You need to quit smoking. And he looked at me and he laughed. I said, no, this is not a laughing matter. And I'm not kidding. You need to quit smoking. He goes, yeah, I've been told that before. Well, have you been told that smoking kills 1 and 2? I take this seriously. You need to quit smoking. So the guy says, well, I get it. I get you're serious. So anyway, so he comes back for a pre-workup, Eric, and I do a body comp test on him, bioelectrical impedance analysis. You talked about it in your HANA fundraiser and your body comp issue. And, we do it on elites and everybody else. But it looked like this guy, because I've done thousands of tests and I'm literally one of the authors in PubMed on the standard of care document on bioimpedance analysis. I said, look, have you lost weight recently? He says, maybe a few pounds. I said, well, you trying? He says, well, not really. I said, how's your strength? He goes, well, it's pretty good. Well, if all you're doing is hitting a clicker and riding in a golf cart and maybe swinging at a ball, you may not notice a strength loss. So I said, okay, here's what I see. It looks like you lost some lean mass. I know you was probably an 80-pack year smoker, 2 packs a day for 40 years. I said, I want to do a chest x-ray. When was your last chest x-ray? So he goes, well, I actually don't remember my last chest x-ray. I said, well, let's just be on the safe side. So we shoot a film. And the radiologist called me. He says, what's going on with this guy? I said, well, it looks like he's got a, loss of lean mass. He's a 80-pack year smoker. Why do you ask? He says, he's got a tumor the size of a fist in his upper lung. I said, all right, what's next? He says, I suggest we get him to the hospital now. He never got out. He was dead in 2 weeks. He was dead in 2 weeks. Someone had to have that conversation with him long ago. And you know what? That's still the way I operate. Hey, hi, my name's Bob. You need to quit smoking. Now, oddly enough, I had a woman come in last week. I actually came in late to see her because she was a super VIP, had access to a private plane. And one of my other VIPs said, Bob, will you see this patient? I said, well, absolutely. So she flies in and basically she had an 8-year cough. And I said, well, when was your last chest x-ray? She goes, well, I've never had a chest x-ray. So guess what? We're going to get one. Well, sadly, she's in the hospital right now. And they're still trying to figure out, well, let's not even go there. Let's just say that they got to run some pretty extensive tests to see what's going on with her lungs. And I hope it's more mild than severe. But right now, we don't know. I'm sending her love and prayers and healing energies. So listen, if you got something going on with your lungs or your heart, get it checked out, period, end of story. And listen, we had a conversation yesterday. I had a patient that said, Bob, I know something's wrong with my heart. Okay, if go to a cardiologist. Cardiologist said, your heart is fine. He came back, he says, my heart's fine. I know something's wrong. I said, get a second opinion. He went back to the same guy. He said, your heart's fine. And I said, look, don't get the second opinion from the same guy. Well, before he ever got to the next guy, he dropped dead of a sudden massive heart attack. Now, the family ended up getting money on the lawsuit, but I think they'd rather have their father, So, hey, listen, just because you're a cardiologist doesn't mean you can't make a mistake and you can't be wrong. If you think something wrong, get it checked out, period, end of story. We don't mess with these things ever. So on topic, off topic, listen, if you think you have a heart problem, start taking care of yourself right now, but get yourself a team of experts that can dot the I's, cross the T's. Make sure if you're approaching a crisis, we get you to live through it. And by the way, medicine can be good for that, right? We talk about functional medicine. That's the ultimate solution. But medicine has application for heart health, lung health, and you know what? Used rightly, it can have application across the board for nearly every health circumstance.
Thank you for going into those details as well. And, it kind of brings it close to home when you talk about patients that come in that you've worked with, but they've gotten to a point where they didn't do their due diligence leading up to that appointment. There's only so much you can do and intervene with. So it's everyone's personal responsibility to keep check on yourself. But also, if you've got a family member that isn't so aware of their own health, is really start to find ways to encourage them to go check that out. Just go and get seen by your GP, go and get seen by a cardiologist, go get a fitness test, go and see a trainer, just to get an overall assessment to see where you are. And when it comes to food, Dr. Bob, how important is adopting a good nutritional protocol when it comes to heart health?
Well, take a look at this. This is the journal Circulation. You still see my Zoom screen. And their very first of the Magnificent Seven, their Magnificent Seven is diet. And notice they're showing fish. Why? Fish have omega-3s, cold water fish a lot better than that. Omega-3s prevent heart attack, stroke, and cancer by 13 different mechanisms, and they are at a profound global deficiency. And then they show an apple, not like Apple Computer, but an apple, a good fruit. And then they show a carrot. So they're showing fruits, vegetables, and fish. Hey, that's a good start. What's not on there? Grains aren't on there. Why? Because grains lay blood sugar. Coca-Cola's not on there because that elevates blood sugar. Now, later we're going to get to coffee. And I'll tell you what, most recent data is nearly every cardiovascular factor is, believe it or not, improved by coffee. And it says arrhythmia is neutral. So, there's been a lot of misinformation on coffee. Coffee can be a superfood, and you and I are not only fond of coffee as a superfood, but coffee with additional superfoods in it. And look out, world, you get that blend and you got something pretty magic.
You certainly do. You really, really do. It's powerful when you can combine things that really serve the body, and you feel the difference. You feel the difference in your everyday life and how you take on physical tasks. There's something really deeply sobering, I feel, if your system is run down and your respiratory or cardio system isn't working as well, and you start to notice, wow, I'm a little bit overworked and maybe under recovered. But when you start to come back to yourself, if you would, how much of a gift it is to realize how it feels to be well again. And I think a lot of people who haven't really been paying attention to themselves over the years just get used to not feeling so good. They just think that is normal. And when we have things like supercharged superfood coffee that we can give to our clients and patients and friends and family, starting to feel this working in the system, it's great to see people really reconnect with themselves on a whole other level. But when it comes to exercise, this is something I've always enjoyed doing since I've been a kid. I jokingly say since I've been training since I popped out of the womb, but I started sprinting as a kid. I always liked going fast. But what kinds of exercise is most beneficial for longevity for cardiovascular health?
Well, Eric, I'm gonna throw a curveball on this, and I'm not going to give you a direct answer on that, but then I'm going to give some data to back it up. So the exercise that's going to get you the greatest longevity is the one that you enjoy the most. So if it's a grind, you're not going to be consistent as a general rule. But let's say that you are a superhero, and you are, so I can say that. Maybe we have a few other superheroes. I see Matt, he's kind of a superhero. Thomas looks like a superhero. Janelle looks like a superhero. That's just who I see on my screen. So we have superheroes with us, but there's something called the 100 Marathon Club. And here's what they found. Half the people that did 100 marathons had what they called cardiac fibrosis. They had scar tissue within the heart muscle, but guess what? Half didn't. But now when we start going to these endurance events, here's what they know. Everybody that completes a marathon, this is the medical literature, has biochemical and electrocardiographic evidence of heart damage. Now, can the heart recover? It can, but you got to do the right things leading up to the marathon. You got to do the right things after the marathon. And that's how we have certain people that do 100 marathons and they don't have cardiac fibrosis. And you know what? They might not even make it through their first marathon if they haven't appropriately done all the things that they need to do to create a healthy heart. Phil Maffetone, who was Triathlon Magazine Coach of the Year, he said, I want to be healthy. And my measure of health is I'm going to complete a marathon. And when he did the marathon, he said he couldn't believe it. They were carting people off on stretchers. I had a patient, I'll call it a midlife crisis. At 55, he said, I'm going to do an Ironman. And he had good trainers and he trained for a couple of years and we had good nutrition. Hey, someone died during that Ironman. If you're going to do an event, be ready for it. Be smart about it. Don't try to climb Everest if you haven't climbed the stairs. Let's build up to it in a very, very, very smart way. But the best exercise for longevity is the one that you feel good enough to do consistently. Now, what does the literature show? It might be ballroom dancing. It seems to be really good for the brain, for the balance mechanisms. I don't know if they've studied that most, but I'll tell you what, I've seen some 80-year-old grandmasters that any non-superhero 20, they're going to kick their butt. Superhero, well, different category, but pretty doggone amazing, really.
Yeah, it's interesting you mentioned that about those grandmasters, as I was learning more and more in my journey about working in, as Paul Chek would say, working in practices, energy building practices, the internal arts like Qigong and Tai Chi, and these grandmasters who have I believe it's the telomeres, the cell health of someone who's in their 20s or 30s, from just really building life force energy by doing exercise around standing meditations, simple shifting of the energy in the body that conditions the whole body, which is a big paradigm shift for a lot of people, especially the gym junkies like myself, who have just explode since a very young age. And then you realize, wow, we need to work with the light and the dark here. We're a complex machine. We need to make sure we're not overdoing it, but also pushing the boat out there a little bit by doing some interval training as well can go a long way for heart health and for healthy body mass as well.
That's a proven fact. And, my guidelines is you want to train every fiber type, every energy system, all of them, but more specifically according to the demands of your sport or life. But you got to train all of them. So, I was at a sports conference a number of years ago, and very, very fortunately, it's coming back. I just accepted an invitation to speak at a global sports conference. I'm so glad it's back to being in person. But they had Ben Johnson, the Olympic sprinter. Now, he got dinged for steroids, but you know what? This guy absolutely hated to run a mile. And by the way, my Olympic sprinters, they all hate their mile. They weren't meant for that mile, but their coach has them do a 3-mile run once a week. Why? Because their overall recovery is better. But most of their training is going to be ballistic, but they got to train every fiber type and every energy system.
When it comes to nutrition in your practice, everyone, of course, is different, but would you have a staple nutritional protocol for someone who's coming in who wants to up their heart health and longevity?
Well, we could quite simply just look at this. And if God made it, it's okay. If man made it, stay away. Make sure that the blood sugar regulation is ideal. There's misinformation on cholesterol. The most important cholesterol number is HDL. Only 10% of people that have cardiovascular disease have an HDL above 60. And when HDL exceeds triglycerides, regardless of total cholesterol or LDL level, people actually reverse cardiovascular disease. We have plants that have high nitrate in the body becomes nitrite, becomes nitric oxide. That dilates blood vessels. That can be really, really good for blood pressure. But the enemy, the top risk factor for cardiovascular is actually inflammatory process. So we need to get good antioxidants. We need to detoxify. We need to get good omega-3s. And we don't want to have processed foods that actually, form acid and inflammatory process in the body. So a whole complete diet. But, I dot every I and cross every T on every patient. We're going to have food. We're going to have superfoods. We're going to have medical foods or functional foods. We have a good multivitamin, probiotics, activated omega-3s, and a combination of D3, K2. And there might be some specific things to heart health. Magnesium is profoundly good for the heart. Coenzyme Q10 is profoundly good for the heart. Taurine is profoundly good for the heart. And then there's certain herbs, right? We could go with Ganoderma lucidum, herb or superfood. Some might put it in both categories, but things like hawthorn, they're good nitrate donors, good for cardiovascular health.
Just when you mentioned about HDL and LDLs, could you just talk just briefly about fats in the body and the role they play for overall health? Because I know there was a whole myriad of lies that were spread around fat, coming into the 80s when fast food was on the rise and people were told to avoid fats, but in actuality, they have such an important function in the body, good fats, that is. Could you just discuss what that is and what's the ideal ratio for omega-6s to 3s? Because I know that that's something people get confused on as well.
Sure. So, fat is essential. And what kind of fat is essential? There's 2 essential fatty acids, omega-6 and omega-3. Trans fats are not essential. In fact, they tend to be generally toxic. I say generally because there's a few natural trans fats in nature. They're just few and far between, but they're a tiny, tiny portion. So an artificial trans fat, that's not good for the body. It's super hard to clear. Now, it depends on where you're from. You look at the Inuit Eskimos, 80% of their diet was fat. You look at people that were born in the desert or in the rainforest, It might be 10% or less, but you want to eat like your ancestors ate. That's going to be very, very accurate. But we go back and, people talk about the paleo diet, and people that are critics of paleo say, wait a minute, which paleo? Are we talking about the Inuit Eskimo paleo? Are we talking about the Aborigine paleo? Are we talking about the rainforest paleo? Are we talking about the Maasai warrior paleo? Because they all had different paleos. But generally speaking, the ratio of omega-6 to omega-3 estimated to be about 1.5 to 1. And a very light estimate for the Western diet, 15 to 1. Some estimates over 25 to 1. And that's pro-inflammatory and a disaster waiting to happen.
Yeah, that's what I believe the advisory structure for the American table of nutrition was something closer to 25 or 30 to 1. High grains, high processed foods, not good at all. Of course, I'm sure that contributed to that increase. That spike of heart issues over the last couple of decades as well was just that poor information that was given to the public.
Well, you have to wonder, was it given or was it purposely bought? Because, on my computer, I have a reference that a Harvard scientist took a big payoff to basically promote carbohydrate and sugar as being a staple of the diet. And that payoff alone may be the greatest cause of death on the planet today. You have no idea what one corrupt act can do, but it did a lot in that case.
Sure did. So when it comes to medicinal mushrooms, this is something we're very, very passionate about as it's so accessible to people now. How powerful are medicinal mushrooms like Reishi or Ganoderma, as it's also known, and Cordyceps? Because these particular ones that we have such a high quality of available to share with people. Why are these so powerful for heart health, Dr. Bob?
But, when we start going to the whys, they're going to have all the nutrition, all the fabulous 50, all the vitamins, minerals, amino acids, proteins, carbohydrates, fat, fiber, and water in doses that make a difference to human health. But just for the fun of it, I looked up on PubMed, over 50 studies on cordyceps and cardiovascular health, and around 100 for reishi or Ganoderma and cardiovascular health. So, they're known to be antioxidants. They're known to be anti-inflammatories. Those are going to be super duper powerful. They're known to help oxygenate. They're known to improve exercise tolerance. And, I'm certainly more versed on Ganoderma than reishi, but it has multiple mechanisms by which it can manage blood sugar and prevent and possibly even reverse diabetes. It lowers blood pressure by a number of mechanisms, and it's actually known to elevate the good cholesterol, the HDL, and to lower the LDL. So, whether we're talking standard markers or the fact that it gives people complete nutrition, buffers their stress, helps the body clear their toxins, and energizes them in a way where they're more energy efficient, better at burning fat, and feel like moving more, all of these things are steps towards better health. And, let's go with Ganoderma plus cardiovascular. And let's just give you the number. So 76, first thing you see is protective effect of Ganoderma, also known as Lingxi, also known as Reishi, on the cardiovascular system. Next, it talks about cardiovascular and metabolic syndrome. And you keep going down the line, inflammatory issues, things like that. But now we go to cordyceps and 57 studies. So you start looking at that and go, so it's interesting. I'm looking at this one, regulation of autophagy. That was Nobel Prize nominated research in cardiovascular diseases by natural products. I didn't check on that and click on it, but here's what I'm guessing. I'm guessing that cordyceps is going to enhance autophagy, which would be, something that's absolutely known to enhance longevity. So notice what it says, regulating autophagy may be an effective strategy for treatment of cardiovascular diseases in the future. So how wonderful that this is starting to get its due. So that was a 2020 study there. Pretty fascinating.
Absolutely. Just for the listener who aren't familiar with autophagy, what exactly is that? What's the significance of that when it comes to heart health?
That's going to be how the body actually clears out dead and dying cells and actually recycles the material within it. So I tell people there's a couple different ways that a cell can die. It could die from a trauma, or what's called as necrosis, or a disease process. When a cell dies that way, its debris spills all over, and it's like, someone blowing up a bomb around you, and you're seeing body parts and things just contaminate the environment. That's what happens with necrosis. Apoptosis is a cellular suicide. The cell automatically knows, look, my life expectancy is over. So it's like the Eskimo that goes on the iceberg and says, you know what, I'm going to float away. I'm not really valuable to my community anymore. And I'm going to go and I'm going to feed the penguins and the seagulls and the fish. And that's still a good way of going. But autophagy says, okay, this cell is sick. It's potentially damaged. It's a threat to us. So what we're going to do is we're just going to say, in a very humane way, we're going to take you and we're going to recycle all of your good parts for the good of the entire body. And that was Nobel Prize winning research. 2016, really, really powerful to know this. So if I just go here, notice it says, generally the induction of autophagy at a low level can provide energy and nutrients for cells through degradation of damaged organelles, that's little parts of the cell themselves, protect cardiomyocytes, that's specific heart muscle cells, and vascular endothelial cells, that's what's the lining of the blood vessel, and stabilize atherosclerotic plaques. Plaques go on very, very slowly, so they don't cause a problem because the body can build collateral circulation. It's when a plaque's unstable and ruptures and goes downstream and creates a sudden blockage that someone has a sudden heart attack. So how wonderful, that Cordyceps is known to do that. And, if you want to spend a fun day, go through all 57 studies on Cordyceps and go through the 76 on Ganoderma. And here's what I think you're going to find out. They're really, really good for the cardiovascular system, and much, much more than that.
I love that. And as we've seen, Paul Stamets, if you guys are familiar with Paul Stamets, he's the one of the most foreground authorities on medicinal mushrooms. He has a number of movies, actually, one of which is Fantastic Fungi. You can see it on Netflix, but he does rank reishi as the top of the top, or Ganoderma, and then second on the list for cross-border benefits for the whole body is Cordyceps. So we do have an epic supplier and partner with Organo, who actually have 100% organic reishi and Cordyceps infused in a habit that people want and love every day, because medicinal mushrooms, they're not easy to come by, especially at this level of quality, but also the consumption of them can be quite bitter. What's so unique about what Organo have done with these medicinal mushrooms, Dr. Bob? And is it safe for someone with a heart condition to enjoy the Organo beverages, whether it's coffee or tea? Because I know for some people, they may not opt for coffee or tea because of the caffeine if they have issues with their heart.
First, I'm going to go to a PubMed article and I'm going to share it with you. And then second, there was a question that came up on Instagram, which is kind of along the same lines. And the question on Instagram is, how do I know if it's a good quality? So you want to look at the quality certification. So ours are GMP certified facility, USDA certified organic, EcoCert, kosher, halal, you name it. So, you want to check the certifications. It's literally that simple. And we have a partnership with IBM. It's called the IBM Trust. And we're literally just days away. We've got the barcodes in place. People can scan the barcodes and literally find out, where every raw material came from, what the quality certification is, et cetera. But here is PubMed. And so if you're looking for PubMed ID, if you're on Instagram, it's going to be 294-74816. But I'm going to read it to you, even though I don't read too many things. Here's what it says. Habitual coffee consumption is also associated with lower risk for cardiovascular death and a variety of adverse cardiovascular outcomes, including coronary heart disease, congestive heart failure, and stroke. Coffee's effects on arrhythmias and hypertension are neutral. So here's the deal. It doesn't aggravate arrhythmia. It does not increase blood pressure. And here's what I'm going to tell you very, very quickly. There's a reason for that. Bodies adapt to constant stimuli. So what they found when people were talking about the adrenals, if someone never has a cup of coffee and they suddenly have one, they're going to have an adrenal jolt. But most coffee drinkers drink 3.3 cups a day. But even at 1 cup a day, by the time they were 5 days in at 1 cup a day, the stimulation of the adrenals dropped by over 90%. And that's in PubMed. So bodies adapt. Now, let me continue with this same article and I'll read you more. Coffee consumption is associated with improvements in some cardiovascular risk factors, including type 2 diabetes, depression, and obesity. Chronic coffee consumption also appears to protect against some neurodegenerative diseases and is associated with improved asthma control and lower risks for liver disease and cancer. Now, what's chronic? Greater than 6 months. Most people I know started drinking coffee, never need to be reminded, never plan to quit. And here's the final line. Habitual intake of 3 to 4 cups of coffee appears to be safe and associated with the most robust beneficial effects. So there you go, 3 to 4 a day, do it, forever and reap the benefits.
Excellent. Thank you, Dr. Bob. I'm going to just address a couple of questions here that came in the chat before we close out the call. Oh, I see Zaf Khan has a question here, I believe. I'm just going through the chat here now. The Heart Foundation has seen a historic rise in myocarditis through the shots. May react different to everyone. More kids have that than that. And some countries put an age restriction on the shots. Dr. Bob, what is myocarditis for people who are not informed? What causes it and what can be done to prevent it?
Well, myocarditis, myo, muscle, card, heart, itis, inflammation, inflammation of the heart muscle. And so I'm going to share a screen again, and I'm going to go to PubMed, myocarditis plus death risk. 747 studies on myocarditis and death risk. And you know what? That's a general search. Well, let's go to item number 2, sudden cardiac death in patients with myocarditis. This is a problem. You don't want to have that. And most people don't want to call it common, but I'm not going to put us prone to censoring. I'm just going to put in myocarditis and vaccination. 999 studies on myocarditis and vaccination. And here's what the first one says: myocarditis following a recent vaccination, myocarditis, pericarditis, cardiomyopathy after a recent vaccination, myocarditis, pericarditis after a recent vaccination, patient with acute myocarditis following a recent vaccination, something with vaccination associated myocarditis in adolescents who never should have got the doggone shot in the first place. And you keep going on. There's 999 studies. So most recently in the US, Eric, oh, by the way, look at the graph here. If you're on PubMed, notice that of the 999 studies, let's see if I can get the highlight on that, 326 of them already in 2022. And how far are we in? We're not even halfway through. And let's go to 2021, 238. So somewhere near 600 of these studies have happened since 2021. And notice what the first ones were: after a recent vaccination. People need to look at risk benefit, but if you like Russell Brand, or even if you don't like him, listen to him. He shares news in a way that opens debate, but he says, they said, well, we can't really recommend boosters for kids 5 to 11 because we don't have enough data. And then a pharmacy board got together and said, well, that's dead wrong. What we need to do is recommend it for kids 5 to 11 so we have more data. Wow. That's all I can say is wow. So I'm seeing a lot of people that got themselves in big trouble for not doing their due diligence, not zealously inspecting all things that they allow to enter their mind, their heart, their soul, and their body. So that's a good formula for success right there.
It's an opportunity for people to learn about themselves, I think, and really do, like you said, do your due diligence. And I understand this is something that gets under your skin quite a lot and gets you heated, and rightly so when you're coming from a standpoint of holistic functional medicine that you are, to see this poor information being pushed around. It's frustrating, to say the least. I see another question here. Thank you, Zaf, for that question. It's a great question. I see another question from Molly. Hello, Dr. Bob. What leads to low blood pressure in a 38-year-old woman who sometimes experiences a racing heart and a pulse rate of 100? What diet and dose of reishi mushroom products would you recommend?
Well, a lot of potential causes, but something's not working right with the autonomic nervous system, the vascular system. Something's not right with the vascular tone. Racing heart, that could be something different altogether. A racing heart could be that this is a person having an anxiety circumstance. It could be that their cell membrane is no longer stable and the heart is firing when it shouldn't be firing. We have to get a little more specific about that, but overall health is what we want to pick up. We do want to eat right, drink right, think right, move right, sleep right, poop right, talk right. We want to manage the stress, possibly a stress reset. That's the first thing I would think of when someone has, hypotension. And then the irregularity, more magnesium, more taurine, more omega-3s, more Ganoderma spores. But, with the stress reset, we do spores, melatonin, and theanine every waking hour. And I don't even know if all those are available in South Africa. I lectured in South Africa. I taught for major nutrition companies. I taught in Cape Town. I taught in Johannesburg, and I have contacts there. So we can help you get the right people, if that's what you're looking for.
I just see one final question from Molly. Dr. Bob, is it necessary for a 78-year-old man to take an aspirin every day for the rest of his life to keep his blood thin? This was his doctor's advice while taking reishi mushroom products daily. What dose of reishi would you recommend to keep blood thin to assist blood circulation?
Well, aspirin's not a vitamin. Aspirin causes bleeding, and it's going to prevent certain issues from happening. So the first question is, do you need it? So there's a very simple test. It's called prothrombin time with international normalized ratio, PT/INR, and people test it. And let's see if there is a clotting risk. If there's not, then why would you put a toxin in the system that's known after a certain period of time to cause GI bleeding? But even recently, they redefined the aspirin guidelines, and they're no longer recommending it. So maybe that's something I'll talk about on tonight's Ask the Doctor. Somewhere I have aspirin plus risk.
I understand we're gone a couple of minutes on as well, Dr. Bob. If you need to wrap up, by all means, and revisit that topic for later, that's absolutely fine.
I'll wrap up with this. It's a great question. So this was out of Harvard. And so here's what Harvard said, and this goes back a little ways, but it makes the most sense to take aspirin if your chance of having a heart attack or stroke is greater than the odds of aspirin causing a problem. And so when you start looking at what's the aspirin risk, and they're talking about a baby aspirin for gastrointestinal bleeding or a hemorrhagic stroke, if a man is age 70 to 79, there's a 1 in 27 probability that they'll have GI bleeding, gut bleeding, or a hemorrhagic stroke. Now, if you don't have a clot risk from your prothrombin time with international normalized ratio, I think the new guideline is clear. You probably shouldn't do it. Now, here's one of the issues. Aspirin's over the counter, so I can legally give advice on that. I wouldn't go against a specialist, but I would go back to the specialist and say, how do you know I'm at clotting risk? What is my clotting? Tell me my clotting numbers. What's my prothrombin time with international normalized ratio? If they can't answer that, I'd say, well, wait a minute, you're guessing. And if you're not assessing, you're guessing. So how about assess? I think I'm worth it. What about you? Is this worth a $10 test? I think so. Order it, please. And if not, you might be looking for a new doctor.
Nicely stated. So thank you so much for the information on today's call. Tons of great information. Really, really great call. Guys, just for next week, or for today, let's deal with today. Dr. Bob will be revisiting this topic at 6 p.m. CST. If you want to invite anyone onto that call, it's the same link as this call right now. This Saturday, we'll be having a conversation around our business. That is a digital franchise sharing amazing reishi infused products. And then next week, we will be touching on fitness and functional medicine, because there is a big difference between fitness and health. Hence the reason why there's a lot of fit, sick people all around the world who are in a lot of cases dropping dead because they didn't do their due diligence on the inside. They were focusing on the outside and performance and not addressing health. So thank you once again, Dr. Bob, for this call. I'll leave the last words to you, Dr. Bob. Thank you once again, guys, for joining the call, and Dr. Bob for sharing some epic information.
Thank you always, Eric, and thanks those who attended and asked great questions. So I always wrap up with 4 questions. So here they are. The first question is why? Why'd you take the time to join us today? So many things you could do. Second question is the answer to the first. Why not? Why not learn a functional approach to cardiovascular disease, which, by the way, is fairly new. This is a fairly new cause of death, and very fortunately, it's been on the decline since 1960. But the elevation were due to cigarette smoke, poorer dietary choices and not moving your body very effectively. And those are things we can all do. Third question is, why not you? Someone's going to say, I'm going to make better choices. In fact, I want some of that turbocharged coffee, especially since I now know that it's so good for my cardiovascular benefit. And here's the final question. Why not now? The longer you wait to act on information, share the replay. This will ultimately be on YouTube. Hopefully YouTube doesn't censor it. We did share some information on PubMed, and I shared PubMed that got censored, believe it or not. So who knows, maybe Heloise will have to cut that out. I don't really know, but what a bummer that we live in a world that, 999 studies, you can't share it. Really? Come on. But why not now? Reach back to whoever referred you to this, reach out and say, I want to try some of this amazing stuff. And by the way, we have a business call on Saturday, and we do have a business of health. So check it out. So if you're in the part of the world where it's good night and God bless. If you're in this part of the world, good day and God bless. So long for now.